Hello, my name is Drew Costello, and I'm a registered massage therapist and a certified personal trainer. And I have been practicing registered massage therapy for 11 years now. I graduated from Sutherland Chan School and with a specialty in sports mostly and spinal cord injuries. I have worked in a variety of settings, the latest of which is mostly sports oriented, the latest of which is my own venture at Bloor and Spadina, and the personal training I've been doing for 5 years.
Good. So I'm Eric Cameron. I'm a registered physiotherapist. I've been practicing for 12 plus years. I graduated from University of Western Ontario, and I think with my specialty, it really varies. Right now, I see a lot of individuals who kind of your 40 plus, let's call it individual weekend warrior, who is just looking to regain as much function and activity in their lives as possible. I utilize several different sort of modalities. So I do lots of acupuncture, exercise specific. I also, right now, I think I've moved from more hands-on manual therapy to more looking at function. And I have a particular interest in why certain individuals, kind of the underlying reasons why they're getting different conditions. And so in a lot of cases, what I'm looking to do is sort of isolate the muscles that are weak or that are working too much, and really identify from more of a functional perspective why somebody is having pain. I also do a lot of pain management. I'm a registered psychotherapist as well, so I also can appreciate and understand some of the psychological components of pain and really how that can influence recovery for people and how it really impacts patients with regards to injuries. So that in a nutshell, I think is a good summary for me. And Drew, so I think today we're going to sort of talk a little bit about, some of the impacts that we've seen with regards to COVID, maybe some of the conditions, the injuries that we're seeing as a result of this pandemic and sort of these unusual times.
This topic sort of came to us from one of the faculty at U of T, who's an engineering prof. So a shout out to the students of U of T engineering who are sitting for prolonged periods in front of computers, workstations that may be good workstations that may be on the couch. So it seems like as time has gone on, at the start of the pandemic, people went from sitting on the couch and not getting those steps in the office. The things that I was seeing before the pandemic and post-pandemic are similar. It's upper back, it's shoulders, it's hips, but it just seems to be a little bit worse psychologically and physically because people just aren't getting their exercise. Treating them very similarly as I would in the past. So sort of working on what's short and tight, which is the internal rotators, and what's long and tight, which is the between the shoulder blades. And then just reminding people to get as active as possible while they're still at home.
Basically bias. I look at it like biasing the opposite position to what you're in all day, right? So,
yeah.
Again, if we go back to the person who's sitting at the desk all day, there's this tendency to go into sort of a forward head posture, to kind of start slouching forward, and especially if somebody's sitting like that for 2-3 hours, that can have an impact, right? So yeah, a big part of what I've been telling people is having those breaks, right? Getting up every 10-15 minutes, just walking around, getting outside. I've been recommending a lot of times too, more so for, let's say, lower extremity, or if people are just struggling from a cardiovascular standpoint, I've been, recommending things like stationary bike pedals a lot more, right? So now that gyms and are closed and sort of other activities that individuals might be doing in the past that's not available right now, I've just been trying to encourage, right? Just being really creative with regards to, okay, so how can we get people to increase circulation, right? How can we get people to start moving, even though there's all these sort of limitations? And then I've been seeing an increase, let's say, in terms of conditions where people would be in those sort of prolonged sitting positions where there's again that rounded shoulder, that forward head posture. So tension headaches, for example, I've seen a lot of just insidious onset of neck pain, back pain. I've been seeing quite a bit more actually sciatica, and with that, basically just prolonged flexion position in the lower back, which is then putting pressure on the nerve roots in the lower back. And so again, you'd see this a lot in the past too with office workers, especially if they were, let's say, driving a lot. Yeah. But it just seems to be having a greater impact. And then also a lot of patients, they're concerned about, okay, now that I'm getting these symptoms, what do I do? Right? Because they've been so inactive. I've also been seeing a lot of impingement syndrome, for like you mentioned about, the shoulders, upper traps, tightness in through the pec area. So then when here's the other tricky thing, is that when somebody does start doing activity, they might actually be more prone, right? If they've gone from sort of 0 to 100, they might be more prone to some of these injuries, like an impingement in the shoulder, for example. So
what do we do for the people, let's say workstations at home? Is there sort of a standard optimal workstation position?
It kind of depends on the condition. So for example, if we go back to somebody who's getting some sciatic-like symptoms, or potentially caused by something going on with, let's say, a herniated disc, well, in a lot of cases, that sort of prolonged flexion or bent type position, right, or that you see in a lot of office settings where you're sitting for a long period of time. Ideally with that, we'd be trying to get them to get up fairly frequently, because that would be one of the positions that again might be creating more peripheral symptoms, right? So in that case, we want to minimize the numbness, tingling going down the leg. And so in that case, we'd want to actually figure out what positions start to centralize the pain. So what positions minimize numbness, tingling, and maybe brings the pain back up into the back. So a lot of cases, it's going to be the opposite, right, of what they're doing all day. So right. I found standing, or quite frankly, with these people, changing positions is most important. But I've also found that prolonged standing can also be an issue, because unfortunately what ends up happening over time is they start to go into a little bit of a standing slump position, if that makes sense. Yeah. Right. So if you're like this, but you're somewhat over, right, you're looking down at your computer, it doesn't really matter if you're standing up, you still might be getting those symptoms, right? So something like using a stool when standing, I found helpful, because it kind of promotes, again, a little bit more extension. If somebody, let's say, has a laptop option, they might go through a period of time where they're just lying on their stomach as opposed to sitting. Yep. And from an ergonomic standpoint, using things like a lumbar roll, using a rolled up towel, just to promote more extension, right? If bending is causing some of the problems. So
basics are getting people to stretch out their hips. Even something as simple as lying on a hard surface on your stomach to eliminate the flexion. And then I guess from there, if you've got tight hips, forward flexion, you want to work first to loosen up what's tight and then strengthen what's weak.
Kind of goes back to function, right? It's like what muscles are not work hard enough or aren't doing their jobs correctly, and then what muscles are actually working too hard or compensating. So yeah, absolutely, I agree with that.
So it's stretching out, like again, so lying flat, just simply starting with lying on their stomach, to get some extension in the low back, working to doing single leg lifts, stretching out the hip flexors.
Like if we're trying to keep the pelvis, so some of the muscles that would attach onto the pelvis, some of the deeper muscles, so pelvic floor, glute med, some of these ones that are going to stabilize the pelvis so your low back doesn't have to work hard.
Right.
So that exercise, more of a dynamic, let's say core exercise with the idea of not hyperextending your lower back when you're doing it. What we'll see a lot of is if, let's say, the pelvic floor or transverse abdominis, some of these deeper abdominal or core muscles, if they're weak, right? Yeah. So the lumbar spine, the paraspinal muscles will kick in to compensate for that. So yeah, but that's where those dynamic exercises can really be helpful, because essentially what you're trying to do is to keep your back in a neutral position while you're adding in all the other sort of components, right? With your arms, your legs, during the initial sort of subjective assessment, to ask them, you know, are you getting numbness, tingling, weakness down one leg or not? And then so based on their answer there's certain tests that we would do to determine if there is a neurological component, if there is, let's say, pressure on a nerve root or a peripheral nerve. So that would include they're called nerve tension tests. So there's something called a straight leg raise test or a slump test. Yep. And basically what these do is they put direct tension on the nervous system. And typically if there's pressure on either a nerve root or a peripheral nerve, that'll create their symptoms, right? It'll make it worse. It'll be painful. They might get some pain into their back, but it'll actually exacerbate the leg symptoms, right? So the numbness, the tingling, the pain. We would also check on myotomes and dermatomes. So myotomes are essentially the different nerve roots correspond to different muscles. And we would test to see if, you know, is there some kind of fatigable weakness that might be linked to a specific nerve root. And then from there, if we say there is a nerve component to it, the exercises or the treatment plan would be step one, to actually get pressure off the nerve root and essentially centralize the pain.
Right.
And then kind of work from there. If there's no nerve involvement, then we're looking at it more from, let's call it a muscular perspective, so that there's either a muscle strain of some type or there's some kind of guarding that's taking place.
Well, massage is very much, we're taught an assessment, but I think that clients are sort of looking to get onto the table as soon as possible. And so I'm pretty good at asking questions based on what is going on, what's your activity level, what's your day-to-day look like, what do you has there been an injury before? So the testing in massage is the exact same as physio, but we just generally don't do it as extensively as physios do, because people really just want to get onto the table. And as I'm treating, coming up with, as I'm moving things around, seeing where limitations are, and then just prescribing exercises based on that. And if a lot of people are telling me the same story, they're sitting at a desk all day, their exercise includes walking, or whatever their exercise may be. If it's only walking, then there's probably not a lot of posterior strength there, which is people just want to have less pain an hour later.
Yeah, I get it.
And then it's just a matter of prescribing them, giving them a better body awareness, and so they're not coming back with the exact same thing 6 weeks later.
And I think this is where like the two professions really complement each other. So
yeah,
I wouldn't say that my expertise is on like deep hands-on treatment. Right. So where I think I'm good at is kind of recognizing, maybe areas that are weak and tight, but then to actually speed up recovery or speed up, I'm just thinking about when a muscle, if there's any sort of fascial restrictions, right? Where it's maybe a muscle's been tight for a long period of time, and somebody really needs some of that sort of deep manual therapy work, that sort of really deep passive treatment. I really think that's where physio and massage therapy, where there's a really great complement. We can sort of send a patient to a massage therapist to get those specific areas worked at, while we're working on maybe some of the other functional things, or again from a strengthening standpoint, just really identifying key areas that are being underused. I really think this is where the two professions really complement each other. But I think just some general rules that I've been telling people, where it is more of a the idea about prolonged sitting, bad posture, these type of things. I mean, there's a couple of principles, let's call it, that I've been noticing that are sort of relevant for many different conditions. And so I mean one thing definitely is just the idea around movement being important, right? So that just how bad, right, it is on sort of the body to be sitting in one place for 8 hours at a time, and just like that as just a general theme with COVID, and how difficult that's been for people.
I think it's,
right?
it's been the like I said, it's a lot of people are just saying not getting up to the water cooler, not walking around the office to socialize, all that, not commuting, has just made it that much worse on people's bodies. So it is, and it is, the movement can make a world of difference, and that's what the treatments are, right? Like it's, massage is, pushing the joints around and getting mobility in there, and along with exercise, it seems to be, these are the times when treatments are that much more valuable. Mm-hmm. Like we're still allowed to work. Right. And that's why people should be still coming out to get their treatments.
It doesn't have to be weight bearing movement necessarily. And I kind of go back to like the stationary bike pedals, like just to get some kind of, like in terms of cardio and in terms of blood flow, circulation, like just how important all of that is. Right. And also, so I think that's one of the just key principles that I've been seeing with COVID. And then also the other thing is, and it kind of goes along with a lot of these conditions that you would see in COVID, is that the body needs to change position. Like, so if we're in one specific position for a long period of time, as a general rule, we need to counteract that as much as possible, right? So, I go back to the whole idea around, if we're in these sort of prolonged sitting positions where the head's forward, where the shoulders are forward. Well, in a lot of these different conditions, I mean, the thing to do is to bias the opposite as much as possible throughout the day, right? So that might look like, what are you doing to open up kind of the chest area? What are you doing to try to bring the chin back, right? And you talked about, the hip flexors, right? So how can you, get into a position where the hip flexors aren't in such a, where they're not in that sort of contracted position so much, right? So it's really like another principle is just the idea around biasing the opposite.
Yep. Stand up.
Yeah, absolutely. Stand up, move around. Even, and you asked about the idea of like the stand-up desk versus the sitting, just regular sitting. I don't think being in either one position is all that great, right? So it's really variety, moving around, going for a walk, maybe setting a little timer for yourself, right?
That's what I say. I say 90 minutes to people.
Right.
Just like every 90. And I think I had somebody yesterday who's converted to a stand-up, and he's getting sore calves. So it's just standing. So again, if you're standing, you're not your hips are extended, but you're not necessarily moving, right?
During this time, like there's so many restrictions on different activities, right? In terms of, gyms aren't open, and there's all these different things that people can turn to and say, oh well, I can't do this, right, because this is closed. But
Yeah.
I think it's really important right now for people to be creative in how they increase or how they do their activity.
Lot, but the people who have gotten creative have changed their body type significantly. Like I have had weightlifters who've become runners and have dropped 15 pounds. Um, so, just very, not everybody can run, but if you are able and you can't get into a gym to work out, then you can run. And that transformation of some clients' body shapes has been pretty amazing. Just to see some pretty people who are quite muscular, who are now obviously runners the second I see them.
Right.
Yeah.
Right.
So.
Yeah. So that whole idea, yeah, just making changes, being creative, coming up with other things, whether it's working at home, whether it's running, like you said, outside, whether it's looking into something like a stationary bike, whether it's, I even look at, I've had a lot of patients use resistant bands, TheraBands as like just a general exercise program if they don't have weights at home. Like you can get creative. It's just a matter of trying to, I think, focus in on what you can do during these times, right? Go for a walk outside. You can still do that. You can still go for a bike ride. Like we said, you can do yoga at home. Like there's things you can do. It's just more about focusing on those things as opposed to focusing in on all the things that are closed, the activities that we're not able to do right now. And I think that mind shift, that mindset is really key in terms of, getting us through this, so to speak. Right. So.
Stay positive. Well, the prolonged sitting or prolonged standing, the lack of movement, so the getting creative and finding ways to be active, for your mental health as well as your physical health. We are still able to work. We are still able to provide people with that sort of body awareness, where a lot of people are just kind of detached from their physical bodies and during this thing. And then just sort of the tests, to again let people know what might be bothering them, and the treatments that follow that, and homework that comes along with treatment. So it's just, again, it seems to be a lot of staying moving, but being educated on how to move. There we go.
Yeah, absolutely. I think you said it perfectly, right? It's about like identifying what the problem is.
Yeah.
And then just sort of having a game plan to do that, and just being educated on what needs to be done from an exercise perspective. And then just knowing that, some of these treatment options, they're out there right now. And, in the office, we're very safe about that, right? Like we wear our masks, we clean up the area. So we're doing everything we can to, prevent any sort of spread in terms of COVID. And then also that there's other options in terms of, if people aren't super comfortable to come in, there's the option of doing things online, whether it's, training or physio. So there's those options as well.
Yeah.
But that, it's available. And I think, especially during these times with the body, it's really important for people to take care of themselves, and that it's important to, to come in, to get the treatment done, and then to be active, especially during these times, right? It's really important. So.